front page, front page of the Anchorage Daily newspaper this morning is kind of discouraging. An Alaska Public Health alert sent out on the increase in heroin overdose emergency department visits in 2021. Since March of 21, Alaska has experienced an increase in heroin overdose emergency visits. Compared to 2020, the average number has more than doubled. So we've seen a doubling from March 1 to May 29. And these are overdose deaths that are occurring in all regions of the state, but most increases in the south central, southeast area. There is still further review that is going on with regards to this in terms of why this increase. Is it supply? Is it purity or potency? It is, of course, always a concern, but when you see that dramatic increase, it causes lots of questions to be asked. One of the things that I would like to raise here as we're in the, we feel like it's the aftermath of COVID-19, but I have heard from so many around the state of Alaska on the need for recovery housing for those that are experiencing homelessness and substance abuse connected with that. So many of our rural communities lack detox centers or any recovery services whatsoever. So this continues to be a struggle for us. But as we are looking to particularly our rural areas and the capacity issues and the funding to offer recovery services, how do we expand access to comprehensive recovery programs in addition to the tools that I'm sure you have discussed as medically assisted treatment? And these are big questions that are not possible to really resolve in a few minutes. But just Dr. Delphin-Rittmon, if you would respond to that, and then also, are we seeing in other parts of the country equally dramatic increases in instances of overdoses in our emergency rooms around the country?
Yeah. Thank you for that question, Senator, and for the meeting that we had a couple weeks ago. It's tragic, to hear some of the stats related to the overdose deaths and the increases that we're seeing. I think it's critical to look at those things we know that can make a difference, and to the extent possible to look at the data to see what's driving some of the trends. Should I be confirmed, I would be interested in following up and having follow-up conversations and discussions with you. One thing that we saw in Connecticut was that fentanyl was driving some of our overdose deaths, and so we're increasing the availability of fentanyl test strips. I think that can be of real value in terms of, helping to potentially reduce overdoses, but also potentially connect people to services and supports. So I think that could be a valuable strategy. In addition, recovery coaches, as we know. You'd mentioned the recovery housing. Recovery housing can also make a real difference. Often within recovery housing, recovery coaches are available. Other wraparound services and supports are available. It does provide an opportunity for people to be connected to other needed services. And so that is a real valuable resource as well. Should I be confirmed, would be very interested in, and again, having follow-up conversations with you. I think the resources that are currently available to states in terms of the block grant, as well as some of the American Rescue Plan dollars, appreciate that Congress's work there, can help to fund some of these innovations that you've mentioned, whether it be recovery housing or enhancing even telehealth. Telehealth, we know, can make a difference in rural areas where there are challenges with connectivity and connecting with providers. So those are just a few strategies that can make a difference. Certainly, as this is one of my priorities, should I be confirmed, would be interested in working with you and, of course, other states and across HHS on this critical issue. So thank you.
Well, I appreciate that recognition. also in our conversation that we had, and I appreciated that, the discussion about suicide and the very unfortunate, again, statistics that we face in Alaska with the rates of suicide, and particularly with our younger populations. We had, since March of 2020, Juneau, Alaska has experienced 15 suicide attempts by children under the age of 15. And, your heart just goes out. Most of those, or the most common method that we saw there was pharmaceutical overdose. So again, how we can deal with these issues that truly just eat away at the hearts of our communities is something that I want to be focused on. SAMHSA does have an important role in these services, but everything that we can do to promote suicide prevention resources, reduce the stigma that is associated with seeking out mental health care. These are all problems that we should share in common and seek to address. Madam Chairman, thank you.